Hello and welcome to the Taking Care of Cancer podcast from the Clatterbridge Cancer Centre NHS Foundation Trust. In this episode, we're looking to the future and we're exploring what's in store for cancer patients 10, 20 years from now, possibly more. And our guests are each playing a part in shaping that future. So I'm really looking forward to talking to you and hearing from other guests throughout this episode, and also what you think was going to be in store. First, some introductions. Sheena, would like to start and introduce yourself?
Yes, hello. Hi Caroline, I'm Sheena Khanduri. I'm the Medical Director at the Clatterbridge Cancer Centre. So I'm a qualified clinical oncologist. That's a doctor who's trained to deliver both chemotherapy and radiotherapy. I specialise in breast radiotherapy, but I sit on the board of directors with professional accountability for the doctors in the organisation.
Thanks, Sheena. And Adrian?
Hello, my name's Adrian Taylor. I'm 54. First and foremost, I'm a husband, father and grandfather, and I'm also a cancer patient.
And Adrian, we need to hear your story first because it is amazing, and I know it's already attracted the attention of people all over the world, hasn't it? Because you're the first person to benefit from a clinical trial being led by Professor Christian Ottensmeier into a cancer vaccine, which sounds absolutely incredible. We'd love you to recap for us, but can you start at the beginning? How was your cancer diagnosed and what sort of cancer was it?
This is my second cancer journey. My first one was officially diagnosed in December 2021, and it was left tonsil cancer, so head and neck. It quickly spread into my lymphatic system in my neck, so at the point that I was diagnosed it was already moving around and become secondary cancer. So from diagnosis I was quickly referred and quickly put on treatment, which was the traditional treatments for cancer, which was radiotherapy and chemotherapy at Clatterbridge. Started the course in January, so just under a month after diagnosis. It was 7 weeks of radiotherapy every day, Monday to Friday. Very tough regime. Chemotherapy was over 2 weeks, week 1 and week 4. And it was tough, physically, emotionally, financially, but it did the job, and I would do it again. There are lasting effects from it, and I came off the treatment in March. Treatment still continued. I was given the all clear on head and neck cancer in June 2022, which was fantastic. But
just 6 months after you were diagnosed?
Yeah, but there was a caveat with it. Something had been picked up on the CT scan in my right lung. At that point it wasn't known what it was, but there was a 9mm object in there which they wanted to carry out further analysis on. Further analysis revealed it was cancer. It had spread through my lymphatic system, and they were looking at options on how to treat that. So pleased that the head and neck was cured, but obviously thinking I have to go through this again to clear this. Surgery was looked at to do a partial lung resection, but that was quickly ruled out due to another medical condition I've got. I'm on blood thinners, so there was a risk there. And even discussing surgery, they said there's a chance that I would die. In my case it was 2 to 3% chance I'd die, and I said to the consultant, I'll take that every day of the week. And she just looked me in the eye and said, put it this way, Mr. Taylor, without treatment there's a 100% chance you're going to die. And it's at that point it hits you, and you just go into survival mode and do whatever you need to do. And the cancer was quite aggressive, and it was spreading and growing very fast, so surgery was ruled out straight away because it had spread into a second part of my lung, and one nodule quickly became at least 6. So I was referred back to the hospital for further consultation with the oncologist that advised on my head and neck cancer, and she mentioned next stage was immunotherapy. And she said that a clinical trial had just come on the market, and before she even finished I said, put me down for it please. And she said, are you sure? I said, just put me down please. I said, anything you can, I'm up for. And the way she was looking at me, I said, look, I've got no choice in this. I'm facing death. I'm in last chance saloon. Put me down for everything. So she referred me to Clatterbridge, and I went through the screening process for Clatterbridge to go on this trial, which was a groundbreaking trial and a first in the UK to go with standard immunotherapy, which is where I met the team at Clatterbridge, led by the professor. And fortunately for me, the screening process, I came through that, and I started treatment in the November. I've just completed 1 year's treatment now, and it's going exceptionally well, better than anyone could have ever imagined, particularly me. So before, when I was told I had incurable cancer and there was a chance I was going to die, I've gone from that despair, and the results of the scans recently have totally changed the world. Where you're going from dark to light, if you like. It's as clear as that. I'm looking forward now. Then I was thinking, every occasion, is that going to be my last occasion? Is it my last Christmas? Is it the last time I have a birthday? And you don't actually look forward to things in case it's the last one, but since the trial, my life's changed so much. It's so positive now. I've done so many things that I didn't think I would. I've seen all these events, so it's fantastic. It is the future, because from the first cancer journey, I do have lasting side effects, and the second cancer journey with the vaccine, it's just like turning up, having the vaccine administered, cup of tea, chat with old friends, and you're on your way. It's non-invasive, and it's just part of your day, part of your routine.
We'll hear from the professor in a minute so he can describe a little bit more about this vaccine, which I know is very complicated. Just describe the moment in which you discovered that it had worked, this experimental treatment had worked. You went to see the professor, didn't you?
Yes.
And describe what happened.
It's one of those moments that I'll always remember, like when my children were born and everything else. I know it sounds stupid, but I went to see the professor as part of my 3-weekly treatment cycle, and I told him that I'd had the CT scan on my birthday, and he said, oh, look, let's have a look at it then. And he spun round in his chair, and he's looking at his PC, and I'm stood directly behind him, and he just started shaking his head, and my heart sank. I thought, this is it. And he just turned round with the biggest beaming smile you've ever seen and said, this is remarkable. I think you might just have gotten away with this. And at that point, the weight is lifted, and you think, I've got a chance. Where before you're thinking, this is it. And it's not about you when you're a cancer patient, because when you're gone, you're gone. It's about those that you're leaving behind. How will my wife feel, my children, my grandchildren, friends, family? And your network, if you look at it in black and white, it's a big group of people, and you think about them rather than yourself. And for somebody to turn around and say, your treatment's working, and you think you might have gotten away with it, that is a game changer. And it's such a fantastic feeling that somebody's giving you a second chance, and I can't express my gratitude for that. I'm thinking, I'm quite emotional now because of it, because I can still remember the look on his face, and it's a look I'll always remember. I'll always see that smile.
You bring tears to our eyes now as well, Adrian. It's such an amazing story. Sheena, how do you feel hearing that? You must be so proud.
Yeah, well, I think I'll echo Adrian's touch of emotion, really. I think we're all feeling it, and I think for me, that really echoes what research and offering research opportunities to patients is all about. There's no doubt we've made great strides in progressing our treatment and our outcomes, but there is still more to be done, and the only way that we can improve on our treatments is through people like Adrian selflessly putting themselves forward to participate in trials where we test newer treatments, we test different ways of delivering treatment, and then monitoring the outcome. And the outcome isn't just in terms of watching the cancer disappear, it's the outcome in terms of watching a husband, a father, a grandfather live a really full life, and that just really brings it home to us. That is what it's all about. So I think it's incredible.
It is. It's such a powerful message as well of hope. So we're just going to pause and listen to Professor Christian Ottensmeier leading this amazing piece of research, which is absolutely game-changing, isn't it? And he's going to describe the science behind it. And I know he's very good at making it simple for us all to understand. So over to you, Christian.
One of the new ways of trying to treat cancer is to use cancer vaccines. These are ways which follow the way we have developed vaccines against infectious diseases, but where infectious disease vaccines try to prevent infection, here we would like to treat a disease, in this case a cancer. The concept is that the vaccine trains the patient's immune system to become good at recognizing the cancer cells, and the trials test whether this actually works. And we now have seen a number of patients, including Adrian, who has done fantastically well on this particular concept, on this particular way of treating cancer. And so the program here in Liverpool is to make this into a bigger story, where we're looking at different ways of training the immune system to recognize the cancer cells, and different trials are asking about which is the best way of delivering this kind of outcome. We believe that the trained cells are going to be the guys that are able to go and get the cancer cells and kill them in the process. So the training also happens naturally, but it's just not very effective. And so what we're trying to do with the cancer vaccines is to help the immune system along at getting good at doing its job. That's the concept of vaccination. Huge change in perception about the role of cancer vaccines over the last 15 or so months. It has emerged that in patients with a particular kind of cancer called melanoma, so a skin cancer, cancer vaccines appear to be able to make a real difference. So patients relapse later or not at all. So in the early stages of patients who have cancer removed but who are at risk of the cancer coming back, it is clear that vaccines are ready to go. And I predict that we will see such vaccines licensed as medicines in the next year or two. In patients where the disease has come back and cannot be removed, we are still trying to figure out what the role of these vaccines is. So this particular study that you discussed earlier, and to which Adrian spoke, is an example of is an example that shows that even in advanced disease, cancer vaccines can make a difference. So that makes us enormously enthusiastic about seeing more of that. And then finally, there is a question about whether you could use cancer vaccines to prevent cancer from developing. That is in much earlier stages, but there's a lot of work being done in this space also. So if I were to summarize all of this, I'm confident that cancer vaccines will play a role as part of the mainstream of cancer treatment, where the exact place is yet to be defined, but we are becoming much clearer about what they might be able to contribute. And I think it's both in preventing recurrence and increasingly also hopeful that they will be part of treatment of disease that we cannot remove by surgery, where we are, for example, otherwise using chemotherapy or standard of care immunotherapy.
So there we have it. That's the cancer vaccine explained by the professor. Sheena, it's not all about cutting-edge research and clinical trials, is it? When we think about research and innovation in an NHS setting, it's very wide and varied. Can you give us a kind of overview of the kind of things that are happening at Clatterbridge to change and improve services for patients?
Yeah, so this is all about service improvement, so improving every which way of treatment and experience that we offer to patients. So this can be anything from, for example, some of our innovation is around how we can reduce side effects of chemotherapy. So chemotherapy is a fairly blunt tool in the sense that it will also attack normal cells, and some of those can be the nerves of the hands and feet, and that can be quite debilitating for patients. It can be anything from a bit of numbness and tingling to not being able to do up your buttons, tie your shoelaces, pick up objects. So it can really affect your quality of life more and above the side effects that you may be getting from your other treatments or the cancer itself. So one of the innovations we've got is around having cold mittens and boots. So similar principles to a cold cap, which helps prevent hair loss. This helps to reduce blood flow to the hands and feet. So that's a novel thing that we've just introduced, and we're going to see whether or not that has an effect. Another one is for patients with advanced cancer that's gone into the spine, so has caused pressure on the nerves of the spine, and patients are nursed in a flat position. It can be very difficult lying flat for long periods of time. We've used adaptive technology to develop screens and that can be put above the bed so they can not only watch telly but order things and be able to interact. So those are some of the innovations that we offer. But research is, yes, the cutting edge, the trials that Adrian has talked about, but there's also a wealth of other trials that we can look at. So we can look at observational or real world data, as we call it, with patient experience of the day-to-day treatments and looking at the effects they have in a real-world setting. We can also look at our staff experience. So one of the things that we did during the COVID pandemic is actually some research looking at the psychological impact of our nursing staff. So research can encompass a really broad range, and it's right and proper that at the Cancer Centre we offer a broad range of studies to not just patients but staff, so we can all benefit and learn.
It's not all about cures, is it? Everything you've described, Sheena, is about improving things for patients while they're being treated.
Yes.
You know, whether that's the position they're in the bed, lying prone because it's in the spine, or those cold mittens for the hands and feet, seem to me to have come from staff and patients together, perhaps coming up with these ideas.
Yes, so we're very receptive to listening to what patients are experiencing and telling us matters to them. And those can often form the basis of a research question. Yes, it's not always about the cutting edge, though that, arguably, understandably is really interesting and exciting and what needs to happen. But yes, it's a wide range of other things, and not always about adding more and more treatment. Some of the studies that we've been involved in are around reducing treatment. So reducing either the duration of the treatment and demonstrating that it's just as effective as a longer course, or the tumour sites and the amount of radiation we give to a person's body, reducing that and seeing if that's safe in the longer term. So not always about more and more. It can be about less being just as effective and maintaining quality of life and minimising side effects. And Adrian, you mentioned about the side effects of radiotherapy, which can be ongoing.
Yeah, I mean the first cancer journey that I had, which I wouldn't change, it got me where I am. The side effects from that, I have no saliva glands now, that they were destroyed through treatment. So I do drink a lot. I struggle to eat certain foodstuffs, it gets stuck in my throat. I've been through therapy to try and improve that, but that's something when it's gone, it's gone. So you can kind of adapt for stuff like that. But you look at the second journey where you've got the cancer vaccine, and although I'm grateful for the first time, you kind of think, well, if that would have been available, would that have changed what's going on up here? I mean, part of the first journey, because they knew I would struggle with my mouth because it was all my head and neck, I had a stomach peg fitted, and I was fed through a tube with like a little sort of protein shake. I had 5 of those a day. I lost 4 stone, and it's very debilitating, and having to build that into your day, that you've got to inject this stuff that's keeping you alive, where you look at the second time around and think, that could have avoided that, but I'm grateful where I am. And even now, things like the side effects of radiotherapy, quite a few of my teeth are starting to chip, which is a side effect of it as well. And it is literally chalk and cheese between the two. And I think it gives a lot more options for the future, and it won't just be a case of one size fits all. There you go, we're going to give you this and this first. If that doesn't work, we'll do something else. If that doesn't work, we'll do something else. The whole approach seems to be a little bit more tailored to me, a little bit more specific to the person, and you're treating the person as an individual rather than cancer as an item, because obviously there's over 200 different cancers, so one treatment won't cure every single treatment, and it's fascinating. As a patient, I mean, it's surreal talking about it. It's something you never want to have to do, but unfortunately the statistic that 1 in 2 people are going to get cancer in their lifetime, it's a horrible statistic, but it's correct, it's factual, and it's a scary number, is that. So there is so much going on, and I think the future is this tailored approach, and I think the more people know about that it's not just that you'll do this, and you'll suffer from this, it is changing. I don't know if it's the silver bullet or the holy grail, but it certainly feels as a patient that we're on the cusp of something massive in terms of cancer treatment, cancer care, and hopefully cancer eradication completely.
You sound like a scientist yourself, Adrian. You've obviously learned an awful lot in the course of your treatment journey. Yes. Sheena, so some of the things you've described, and what Adrian was talking about, this was the side effects of treatment. Of course, 20 years ago, we've improved a lot, haven't we? You mentioned about treatment not lasting as long, possibly, or not as much radiotherapy as we used to have. So just to put that in context about how far we've come and how different it might be in another 20 years' time. 20 years ago, if you were diagnosed with cancer, what might your treatment have looked like? What would Adrian's treatment have looked like, possibly?
So treatment has changed considerably in that time, and we might have been giving chemotherapy for longer periods of time. So I can certainly say for breast cancer, treatments were 12 months of chemotherapy, for example, and then research through trials and through patients participating in them, we demonstrated that 6 months was just as effective as 12 months, but spared you all that time. We know that treatments can have side effects on other organs of the body, so for example the heart, and now we've been able to limit the types of treatment we give so they have less side effects on other organs. In terms of radiotherapy, we've made huge advances in the precision of radiotherapy. Adrian would probably have had 2 or 3 plain x-rays, and the consultant would have drawn on that in we call it China graph, so it was a pencil and dotted out areas they didn't want to treat, and then that would have been transferred into a treatment plan. Now we're having complex CT scans, merging them with MRI scans so that we can really see very clearly the areas we want to treat. That's all being outlined with great precision, so we're within a few millimetres of precision accuracy, and making sure that each day that treatment is being delivered accurately, and making those tiny adjustments. So the way in which we deliver the treatment has changed immensely to ensure that it's safer, it's kinder, but just as, if not more effective than our previous treatments.
This might be a good moment to pause to listen to the Chief Executive of the Clatterbridge Cancer Centre charity, Katrina Bury, because the charity recently has become much more involved in supporting research and innovation, and I think Katrina's best just to describe that for herself.
So the charity has always supported research, But while we were doing the big appeal for the hospital, to perhaps a lesser level, but now we've really ramped up. And the thing about research in the NHS is that the NHS doesn't really support research, and so there are funds out there, very difficult to come by, and so it's really important that the charity is able to actually provide those funds. So the charity actually provides funds that are over and above what the NHS would support. So it's a real opportunity for us to actually engage with, now that we're in the heart of the Knowledge Centre, and with the university and with our consultants, our research consultants there, to be able to really ramp up our research. And the best thing about it is that the research that we're doing there, that our consultants are doing, is directly for patient benefit, and it's local people. It will have a global influence as well, and regional, national influence, but it does actually really support local people. And our supporters really enjoy that, I think, idea that they can actually support something and they can see it actually happening on their doorstep. So it's been really good for the charity to move to Liverpool. Because we're next to the Knowledge Quarter, next to the university, what it has in actual fact enabled us to do is ramp up our support of research. So because we actually, a lot of our consultants are at the university, our patients are over the road, and it's made it so much easier for us to kind of, promote that, the research capability that we have. The cancer vaccine development that has been going on at Clatterbridge. So we're a big supporter of that, and we've actually bought some kits, some specialist equipment for the researchers there to enable them to actually make better decisions about who should receive treatment, so they can enable them to go on to clinical trials. So, so sort of very, very high level research, and we've been able to fund that. But we've also funded basic research, so on exercise for patients as well. So it's a very, very varied range. But there are probably about, any one time, about, 15 projects that we're supporting, the charity. We're the only charity that actually supports research and patient care. But to be able to directly impact research, because cutting edge research that will make a difference there, absolutely, to patients, is brilliant. It's very sort of humbling when you talk to the patients and see what they're going through, and but to actually know that we can, or charitable support, our donors are actually directly supporting those people and making a difference.
And that was Katrina Bury from the Clatterbridge Cancer Centre charity, which leads us on to think about, why doesn't every patient ask about what trials are available and step forward to take part when they are available? It's not easy, is it, encouraging all patients? And there is some reticence, isn't there, about clinical trials, Sheena, would you say?
I think for some patients there may be some apprehension. Some people are worried about being guinea pigs. Cancers, it's scary time anyway, so the added worry of having to take on more information about different treatment choices and options, it may just be a bit too much at that point. But I think it would be important to encourage patients that there's enormous amount of rigorous testing before it gets to a point that we offer patients access to novel treatments. Even if they are first in human studies, there's still a great amount of rigour that goes on in the background, and there are other treatments that may be in use in other cancers, and then we're applying them to the particular cancer the patient in front of us might have. So I think it would reassure patients that actually it is very safe, and if you're being offered a trial, it's because your doctor feels there's going to be benefit in you and others in participating in that.
You are more closely monitored as well, aren't you, if you're on a clinical trial?
Yes. Even if you're on the standard arm, so for a trial, we generally, in very simple terms, have what the standard treatment is, and then the trial treatment, the experimental or new treatment or new process that we're testing it against, and we're looking to see whether further down the line there's any difference between the two. So even if you draw the standard arm, you're still getting monitored very closely as well. So it's beneficial all round, really.
And Adrian, of course, you can tell us, you had no hesitation, did you, in taking part in the trial? But what was the experience like for you? So presumably you were being treated by clinical trial staff as well as by the doctors?
Yeah, for me, it doesn't even feel like I'm being treated the second time. I mean, the first time, the radiotherapy and the chemotherapy, you were going through it, you were dreading turning up, you knew how you were going to feel afterwards, but at this time, you actually feel a little bit of a cheat or a fraud, because you turn up, you have your cannula put in, you have your vaccines injected through that, you have your standard care immunotherapy goes in on a drip, you're monitored, your observations are taken every 30 and 60 minutes, and a couple of cups of tea, chatting with the doctors and nurses, which they become like family. They're part of your network as well. It's not just about your immediate family and friends and colleagues. It's the people treating you, that they're on the journey with you, and they're supporting you. And as Sheena said, it is all tried and tested. That it's not something that somebody's just pulled together in a lab with a junior chemistry set or anything like that and say, try that, see how you get on. It's got all the science behind it, all the data behind it. You're in a controlled environment, everything's monitored. My treatments are every 3 weeks. I go on the Monday, I have the consultation, I have all my bloods checked, and on the Tuesday I go ahead with treatment. If there's anything that needs adjusting, it's adjusting, and so far there hasn't been. It's been a very positive experience for me, and if you go back probably to the 80s when I was a little bit younger, they used to advertise clinical trials in the newspapers, where we'll pay you for your time, and okay, you might grow a second head, your left leg might fall off or something like that, and I think that's a lot of the doubts that people have now. They think back to the odd case and think, I don't want to be the guinea pig that doesn't make it out of the lab, and there's none of that, and even if I wasn't in Last Chance Saloon, if somebody gave me that opportunity, I'd go for it, because it's not just about me and what I'm doing with the hospital now. It's about looking after the future. I'm a massive believer that we're in charge, we're custodians of this moment in time, and it's up to us to leave things in a better position than where we found them. And to me, this research is doing that, and my children and my grandchildren and anything beyond that could benefit them, particularly if this 1 in 2 continues. So I'm happy to be on it, and if anyone had any doubts, I would say just go for it. And looking at the old phrase, what have you got to lose? I look at it another way on that. It's, what would you lose if you didn't have this trial? If you weren't here anymore, what would your family lose? I mean, this last 12 months, my stepdaughter got married, and she'd planned the wedding a year before. And I said, I don't know if I'll be there. And I was so proud last November to walk her down the aisle. And my daughter and my stepdaughter both graduated from university this year. I was there at their ceremonies. I never thought that'd happen. And now everything's positive, and you look forward to things. Christmas around just gone, and that was fantastic. I didn't think I'd see that Christmas, and I've got my birthday coming up next month. I never thought I'd get to that, and it just opens everything up. And when you haven't got cancer, you actually think you're invincible, and you don't think about dying. But when somebody says you are going to die, you believe it. But now my thoughts are clear now. I'm just taking each day as it comes. I'll be here later this year at Christmas, and the Christmas after. I'll be there for my family. I'll watch my grandkids grow up, and it's positive. And this trial, this vaccine, this innovation, and the donations from the charity that are helping fund this, that's why I'm still here, and I'm so grateful. So any doubts from anyone over the effectiveness, just go for it. And I get quite a few inquiries through social media, people I've never heard of, saying they've seen my story, they've heard about this, and how do they get some of it? And we have referred quite a lot of people, and the feedback has been tremendous at the hospital.
And of course we have to be careful here, don't we, because Sheena, I'm sure you want to step in here. It's not actually going to be appropriate for everybody, is it? But the fact is that there may be other things available if people just ask the question. So Sheena, what would your message be to people who've heard Adrian's story and thinking, gosh, yes, absolutely, I want some of that. But it's not going to be available to everybody, is it?
So it'll either not be available or it won't be suitable. So all trials have strict criteria where we make sure it's absolutely the right thing for that individual in front of us. But we have a broad range of trials. There's many trials that are available. So I would encourage patients to ask their doctor, is there a trial that's suitable for me in this hospital? Is there something I can participate in, or is it appropriate for me to go elsewhere? Obviously, with going elsewhere, people may have to travel further away, and so we'd like to make sure we can encourage patients to be able to access trials, as many different trials that are available in their own hospital.
And all power to Clatterbridge and to the charity for now supporting more research happening in Merseyside. So it's just a fantastic endorsement of what's happening in Liverpool, isn't it? And supported by the local population. If we now think about rounding up this conversation by looking into our crystal ball, and I was going to ask you, we're talking about taking care of cancer. That's taking care of cancer patients, but also taking care of cancer as a disease. If you spin forward 20 or 30 years, what would your prediction be, looking at it from either perspective? Do you want to go first, Sheena?
Yeah, well, when I look back at the changes that have happened in a relatively short space of time, the art of the possible for the future, wouldn't it be wonderful if we're having a podcast or whatever happens in 20 years' time saying we've eradicated many cancers? I mean, wouldn't that be phenomenal? And the technology is advancing at such a pace and we're learning so much. And what we haven't touched upon is the role of diagnostics and artificial intelligence, and so trying to detect cancers earlier and earlier at a stage when they're going to be curable, or preventing them in the first place. So that to me would be where absolutely we would want to be. But we know that there's more and more people with cancer being diagnosed and then living with cancer. So we'll be seeing cancer more and more as a chronic disease. And for those people who are living with cancer and living with the side effects, we would want to ensure that the treatments that are available are as kind and personalised as possible to be minimising side effects, so that if they are living with cancer, they're living a full life with it.
As Adrian is now. Adrian, any final words from you on the future?
And that's the difference, and it's getting people's mindset that cancer isn't a dirty word, and it's not an instant death sentence. I've gone from dying of cancer to living with cancer. And the view of my particular cancer, my lung cancer, traditionally has been beyond 5 years, it's only 4% survival rate. So you look at your family and you think, okay, at least 1 or 2 people in this room wouldn't be here to see in the next decade, and that's a scary figure. And a lot of what you read about, and you read comments from people, and I think the thing that everyone's looking for, which might not be possible, is that preventative. So you buy a packet of tablets from the chemist, pop one a month or whatever, and cancer won't come. But cancer's very, very complicated. There's over 200 different varieties of it, and it's nailing every particular type. There's not one size fits all, and I think that's where people want to go. And while I've been on my journey, obviously you get all your social media feeds are full of cancer, and you see a lot of the innovations, and people are talking about potentially in an American study, lung cancer won't be around in 2050, and you think, oh, she is away. That'll be here in no time at all. And you hear, even in the Middle East, in Israel, they've developed a treatment that literally teaches the cancer to commit suicide. It kills itself, and you think, how cool is that as a concept? How simple is that, and why didn't we think of it earlier?
So your prediction then for 20, 30 years' time is, first of all, we eradicate cancer, Also, we're going to have a pill we can pop just to stop it happening in the
Hopefully.
first place. Amazing. Okay, so we'll pass that on to Professor Ottensmeier. That's his next challenge. Thank you so much. It's been such a joy listening to you both and listening to your story, Adrian. Thank you so much. Adrian Taylor and Dr. Sheena Khanduri. Thank you.
Yeah,